Kamala Harris, without a doubt, everything that you can think about that is bad about abortion, she is in favor of. No gestational age caps for abortion. She wants abortion to be paid for by the state. She wants it to be available without parental notification or without parental consent.
I'm Dr. Duke, and this is my take on the news. I'm joined today by Dr. Bill Lile, who is a gynecologist and an obstetrician in Florida, and somebody we've talked to before, and we like to get his opinion on issues. And you've got a really interesting take, a video you did I saw recently, about the new vice president for the Democrat Party, Kamala Harris. Give us some insight on your thoughts about her and the entire process of choosing a Democrat vice president this go-round.
Oh, well, first of all, you have to look at what has she said and how has she voted and what kind of behavior. I mean, you look at somebody by their fruits as far as who they are and what they're going to be in the future. And she is without a doubt not only the most left-leaning, but the most pro-abortion, anti-life major candidate that we've ever seen seeking the office of president or vice president. The theme of the DNC convention was we the people, but you can look in our own Declaration of Independence and you can see that all men are created equal and are endowed with certain unalienable rights, one of which is life. Well, when are we given those rights? First the rights came from their creator, capital C, but when are we given those rights? It doesn't make any sense that we were given those rights at birth, because do you not have rights at 25 weeks if you deliver early, and then the rights are bestowed to you when I do a delivery? The only thing that makes sense is that our rights are given to us by God at that moment of creation. Even in Scripture, it says we are created in the image of God. Well, we're not created in the image of God when I deliver you. We are not created in the image of God during the first ultrasound. The only thing that makes sense is we are created in the image of God at the moment of conception. Kamala has talked about healthcare and how abortion is considered a healthcare. Well, healthcare deals with patients and it has to do with healing. And we treat the preborn as patients and we heal the preborn in the womb. So if they are patients, they are persons. On the first visit, we will get blood work. And one of the tests we look for is an antibody screen to see, does the mom have antibodies which can attack the baby's blood? Why? Because the mom can see the baby as a completely different person and will start to attack that baby. If that baby is attacked by the mom's antibodies, the blood count can drop so low that if we don't intervene, the baby will die. We have done blood transfusions here at my hospital as early as 18 weeks gestation, where we put the blood right on the inside. So we also are now doing heart surgery at 22 weeks. We're doing spine surgery at 22 weeks. If they are a patient, they are a person, and they are created in the image of God at that moment of conception. Kamala Harris, without a doubt, everything that you can think about that is bad about abortion, she is in favor of. No gestational age caps for abortion. She wants abortion to be paid for by the state. She wants it to be available without parental notification or without parental consent. She's from California. She was the Attorney General of the state of California before she came as senator. On January 1st of 2021, the abortion pill, which is 96 to 98% successful in killing a baby up to 10 weeks gestation, will be available at every California state college or university to the students. And that will be paid for by the state of California. So she wants universal paying of abortion. She wanted it at any gestational age for any age patient, and you don't have to even have parental notification or consent. It is evil. It is just an evil that is not healthcare. Taking a life is never healthcare. If I can treat them as a patient on the inside, then taking their lives is not healthcare.
Yeah, and I appreciate what you say about Kamala Harris being among the most extreme, but this is the same Democrat Party that removed pro-life people from its own platform. They got about 20 years ago, they got rid of God from their entire platform. They don't even mention him now. When they read the Pledge of Allegiance at the opening of this convention, they skipped under God. This is the same Democrat Party now that says if you are pro-life, there's no such thing as a pro-life Democrat. That being a Democrat in this country now means you support exactly what Kamala Harris supports. So there's not even restrictions on abortion you're allowed to have if you claim to be part of the Democrat Party here. And so I guess I'd ask you this question. What you said about the creator is really big, because once you get rid of the idea of a God, or the idea of a creator, then human beings have to become the arbiters of when we live and die, don't we? And what you're seeing behind much of the Democrat push to abortion is eugenics. It's just a fancy way for saying eugenics. We'll decide who lives, how long they live. We'll decide whether we're going to let them be born or not. And I fail to get, in my mind, how that's different than what actual eugenicists were doing, trying to, like Margaret Sanger, the founder of Planned Parenthood, who wanted abortion on demand to get rid of black and brown skinned babies. How do you draw a line between one kind of experimental eugenics and another?
Well, throughout history, if you've wanted to take advantage of another group of people, the first thing you have to do is say they are not a person. We saw that in Germany with the Reichsgericht, which was the German Supreme Court, said that Jews are not persons within the legal sense. We saw it here in the United States that Native Americans were not persons in the legal sense. We saw it with George Canfield wrote about how women were not persons in the legal sense. That's why they were not allowed to vote, which of course we just celebrated the 100-year anniversary yesterday, allowing women to vote. We saw that with African Americans as well here in the United States, that they were not persons. We saw the Virginia State Supreme Court say that the blacks people were not persons in the legal sense. And in Dred Scott in 1857, even our U.S. Supreme Court said that then they were not fully persons. So was that corrected in 1857 with Dred Scott? Yes. Was the U.S. Supreme Court wrong when they said in 1973 that the preborn were not persons? Yeah, they were absolutely wrong, just like when they said that black people were not persons in 1857. One was corrected, and a decision made in 1973 needs to be corrected as well. We've lost 62 million lives in the womb here in the United States, and that number is growing. Also, there was a federal judge in Maryland 2 weeks ago that removed what are called in-person REMS restrictions, saying that because of the pandemic and COVID restrictions, that if a woman wants to get the abortion pill, which again will kill the baby up to 10 weeks, 96 to 98% of the time, but it's too much of a burden for her to actually come into the clinic. Well, one, that's making accessible over mail order and virtual medicine, the abortion pill, but it also puts women's lives at direct risk. The number one killer of women in the first trimester of pregnancy is a ruptured ectopic pregnancy. If somebody is going to be getting the abortion pill mail order, they might think, oh, this cramping and pain is doing what it should. It's aborting my baby. Meanwhile, they can have a pregnancy that is in the tube, and the abortion pill is not a treatment. It is not a therapy to fix a ectopic tubal pregnancy. And that woman can die thinking that, oh, I took the abortion pill, everything is all right. So does it kill the lives of the baby on the inside? Yes. In fact, at 10 weeks gestation, we can do a blood test on the mom, and I can screen for dozens of different things, and I can even look and I can tell you the gender of the baby. I can tell you 7 weeks after conception with a blood test from the arm of the mom if this is a little boy or if this is a little girl, way before I could even determine that on the ultrasound, because there are little fragments of DNA that are from the baby that we can separate out, because the baby's DNA and the mom's DNA are different. They can have different blood types, and they have completely different DNA. I can now analyze the baby's DNA for dozens of different things. If it is a patient, it is a person. If it is a person, it deserves to be protected.
The progressive left is forever bragging that technology and science is on their side. In this issue, the more the technology increases, the more difficult it is to argue that a child is not a human being. Why is the progressive left so fighting science on this issue?
You know, I really feel that we are wrestling against a demonic force. I mean, Scripture tells us that we wrestle not against flesh and blood, but against spiritual powers. And I really feel that this is a spiritual evil. If you look at YouTube and you put in fetal surgery, and you can see how we can actually do heart surgery, spina bifida surgery, operate on twins, give blood transfusions. If we can do those sorts of things, they are a person. And it is a blindness when people do not recognize that this is a person just as valuable as you and I.
Dr. Bill, before you go, give us a place where people who want to find out more what you have to say, a website where they can watch some of your videos.
My website is prolife.org. You can also go to DRLILE for YouTube, and that's all up there.
Dr. Bill, thank you so much for your time today. Dr. Bill Lile, we appreciate you.
Thank you.